Another life Esidimeni waiting to happen. No matter how well-intentioned the NHI is going to be, it is going to cost South Africans, and some may pay with their lives. How many ministers and senior government officials, the decision makers about where and when we can access healthcare, how many of them use the public system for themselves and their loved ones? To call it hypocrisy would be mild, says our next guest. He says it's downright evil, and if anyone should know, he would. He was at the helm of the South African Medical Association as chairman and more recently president of the Health Professions Council of South Africa. In fact, at a point, he was also at the helm of the World Medical Association. This is the representative body for physicians around the world. Dr. Kgosi Letlape joins us on 702 Breakfast. A very good morning and welcome back to our program.
Good morning, Bongani, and good morning to the listeners.
I mentioned in my introduction that you were the first black president of the World Medical Association. You were also the first black ophthalmologist. You achieved that, of course, in the apartheid years. Yours has been a career at the very top of your field. If anybody knows medicine, or at least being a physician, it's you.
Well, there are many of us, but I'm glad to be one of the many that have studied in this country and have served all their lives in South Africa.
I mention your pedigree because I think it's important to set that background for our listeners so they understand exactly why your perspective is informed in the way you think. You were also a longtime member of the ANC, a party which you quit this year. You worked with even Nelson Mandela to initiate the provision of HIV treatment. Why did you leave to join Action SA?
Well, we've been talking about access to healthcare for all for many years in the ANC and in the medical sector. I remember with Dr. Tulare, when she was the CEO of SAMA, we spearheaded national health talks, moving towards that when Dr. Zweli Mkhize was the chair of the health committee inside the ANC. So it's something that we've wanted for ages. It's what all of us would talk about, seeing the deterioration of the sector, seeing the difficulty of access to patients, the lack of funding which started in apartheid years of the public sector. You wanted to have something where you could sit as a healthcare professional and not talk about money with the patient, just talk about the patient's needs and do for them what they need.
So is the NHI the way to do that, the way to achieve that? I mean, it's quite clear our system is in urgent need of dramatic change.
No, it is not. Everybody talks about the care that you need, packages, universal health coverage, and in the NHI, there'll be issues about benefit packages. If you just think about it, Bongani, where do we have universal health coverage? In the public healthcare system. When you go to public healthcare, they don't tell you that you're covered for this, you're covered for that, you're not covered for this. They will look at you and give you what you need. The challenge becomes where the system is not properly resourced. We don't have drugs. I can't do this investigation. You got cancer, you need radiation, our machines are not working. Wait it out, try and get it in private. So if were really serious about universal health coverage, the way you do it would be to fix the public healthcare system, and all of us go there. The hospitals are better distributed than private hospitals. The clinics are everywhere, including in rural areas. That is the backbone. That is how you can provide universal health coverage.
Isn't that we are told, if I may just come in there, Dr. Letlape, isn't that what we are told NHI seeks to do?
No, NHI doesn't seek to do that. NHI, as they explain, sometimes we don't listen carefully. Those that propose it will be quick to tell you that NHI is not it's just about funding. There are many components to a health system. Now, can you imagine the challenges that we have of failing infrastructure, inadequate human resources, not being equipped, and lately, lack of security? I mean, you had a debacle in Mpumalanga. I have a colleague of mine, a young ophthalmologist in Tata, that had to close her practice because of extortion and violence in Tata. She can't work. So money is not our primary problem.
What is?
Just imagine about money. Once you have the fund, so what? What are you going to do? Where do the people go for their healthcare? How do you manage those resources? Payment. You're creating a difficult system. If you're now saying you want people to define benefit packages, if you're giving universal health coverage, you just need an information system. You just need proper treatment protocols. You just need to listen to the profession, what best they can do with the resources that you have. You don't need to create jobs for people to define what you can and can't have. Remember, that's what benefit packages are about. They are mutually exclusive to universal health coverage.
You've also said one of the things we have seen in this dispensation is class being the new apartheid. What do you mean by that?
What I mean about that is that South Africans that have resources live in a different world. We live in suburbs that are safer than townships. We take our kids to private schools that are in better shape than public schools in general. We have medical aid. We go to private clinics where access is better and the services are better. It does not necessarily mean that the outcomes are any better. So we live in a different world. We, some of us, have private security. I mean, if you look at our executive has SAPS at their beck and call. You know, I was just thinking the other day that there's a number that was given that in South Africa you have one policeman per 400,000 citizens. And just the other day, 8 of the Vice President's protection unit was in court. They are suspended. But he still got a full contingent of people that secure them. He lives in a different class. He lives in a different world. When we talk about the realities of South Africa, the class might be exposed to some of the things. I mean, there are things that are common. Potholes are the same for all of us, you know, and security issues are the same for all of us. But class matters in this country.
So the decision makers...
Apartheid is now about money and not about color.
So the decision makers ought to be subjected to the same system they provide.
Yes, we should. I mean, if we are public servants, if we serve the public, and we are advocating that the majority of the people use the public healthcare system, we should lead by example. You know, I remember some years ago the president quoting an example of his counterpart in Sweden sharing a hospital with a commoner, with a minor. And he said, that's wonderful. And that's what we need to do. You know, human beings are just driven by self-interest. And if we want the lot of the majority to improve, we should be in the same pool with them. We should have skin in the game. And then that's how we will lift the fortunes of the less fortunate, by being with them. The key issue about national health, the key issue about a system that is equitable, is solidarity. We must be in it together.
You talk about solidarity. Of course, one of the things you have personally been let down by is justice. And as somebody who has spoken to you a number of times, my heart went out to you and your family when I heard about the loss of your daughter in the most awful way. And you're saying the justice system isn't always geared towards helping the victims and their families.
Yes, you know, I was reading the Constitution the other day, and in the preamble, they talk about the rule of law. And sadly, in South Africa, it has ceased to be the rule of law. It has become the rule of lawyers. If you can afford lawyers, you can get away with anything, and you may be able to get justice. But if you're just dependent on the law as an ordinary citizen, you're in for a very, very tough time. I've seen the lack of skills. I was at the scene, seeing the forensics doing their work, and you then sit there and you say they're doing their best, but they've not been properly equipped for the job that needs to be done. You then wonder, you stop wondering why cases get thrown out because of lack of evidence. Matters are being investigated forever and ever because the creme de la creme of the police force are a private security group for the executives of this country. The skills are not there. The training is not there. And the people mean well, but they need to be supported. They need to be given the skills. They need to be given the resources so that they can comb crime scenes properly. I mean, when you listen to Senzo Meyiwa trial and the holes that are punched in processes, your heart just bleeds.
Do you think justice will come to your aid?
I'm not holding my breath. I've seen every day people suffering secondary trauma. Bongani, a few weeks ago, there was a mother whose daughter was set alight by the boyfriend and died. 4 years later, the case gets postponed for further investigation. That's the system we live in. So we've got a system that has swung the other way, where there's justice for perpetrators. There is no justice for victims. And it is something that I have reflected with some of my friends, they are seniors in the ANC. We've lived together to say, at the dawn of the new era, we've swung the pendulum. Remember, we come from a history where people were being tried unjustly. They were being sent to prison for no crimes committed. They were not being given proper representation. But we've swung completely the other way.
And just for clarity, Dr. Letlape, I've got to be able to inform the listeners. Your daughter, of course, died at the hands of her partner, and that's why gender-based violence and that scourge of femicide is something that is so personal to you. You describe staying in the ANC, being a member of the ANC, as akin to being in an abused relationship.
Yes, when you're in a relationship, you are vested in it, and you do your best to make it work. And what happens typically in relationships that have gender-based violence as part of that relationship, you're still hoping that your partner will change. And you end up dying in that situation. So we've sat in the party and lamented for years, hoping things would get better. And you don't have the courage to walk away. And basically, I see myself as one of those. And the reason I walked away was because I got outside help. I was invited to join Action SA. And I had to consider that there are people that come to me and say, I can make a difference. I've spent most of my life in the ANC, in the New Democracy. I've worked with Utata. We were part of bringing the Medical Association and the Nelson Mandela Foundation together so that ARVs could be made available for the first time in the public sector. And then it takes someone outside to say, we think you can make a contribution in Parliament. We think we can make a contribution to policy formulations of our party. So the same thing with people that are trapped in violent relationships. Most of them would be saved because somebody outside comes and says, this is not worth it. You're going to die in here. Come out. Because when you're in there, you can't help yourself.
Dr. Letlape.
Being inside the ANC, for me, has been a similar experience. And I hear my friends, we lament about, this is bad, this is terrible, but we still go back to vote for them.
You've given us food for thought this morning. Appreciate your time, and my heart goes out to you and your family. Dr. Kgosi Letlape, an ophthalmologist, now a member of Parliament for Action SA.
Current events, developing stories,
tough questions.
Your voice making a difference.
This is Breakfast with Bongani Bingwa.